Hi, my name is Chun Kim, registered nurse studying at Brigham Young University, Idaho. Understanding the basic safe Botox practice is key to successful treatment and outcome. Registered nurses are often undertrained compared to physicians or nurse practitioners. So this video was created to help new nurses and also for older populations who are interested. So what is Botox? It is produced by botulinum toxin. It's a neurotoxin bacteria called Clostridium botulism. What it does is that it blocks the release of acetylcholine, causing muscle paralysis, which blocks muscle contractions and eventually wrinkles. It takes about 24 to 70 hours to take effect and peaks at about 10 days and lasts about 8 to 12 weeks. So it is important to know that this is a temporary paralysis. Some patients, after they receive Botox treatment, they often complain that they don't see the result right away. They expect the result within 24 hours or like within a few hours. But it is important to set the right expectations for patients before the treatment. And since it's only temporary, they will see the result after they won't the result won't last forever. So they're not wrinkle free forever. So for the best result and maintenance, it is recommended to receive Botox treatment every 3 to 6 months. First-time patients, it lasts longer than patients who's been getting for 20 years. So it is safe to say that you can come back in 5 to 6 months after the first Botox treatment. Not only wrinkles, it can also treat clenching habits, gummy smiles, migraines, and anything that reduces the muscle. So for equipment needed for Botox, we need 2 types of syringes. So the botulinum toxin unit is a unit which is a very small amount, and 3 milliliter syringe is used for reconstitution with the saline solution. I had a new nurse who forgot to use saline solution, so instead of saline, she diluted the Botox with sterile solution, and it works, but it is painful for the patient, and she never came back again after that treatment. So it is important to know that you use the saline solution, not the sterile solution. And for the actual injection, you use 1 milliliter syringe. It's a very small syringe, and 25 gauge to 30 gauge needles. I prefer using 30 gauge using smaller needle to reduce bruising, and also very importantly, gauze and alcohol sponge for sterilization. So these pictures explain how to reconstitute Botox, and for the purpose of this video, I'm going to use Botox Allergan. It's the only FDA approved Botox in America, but there are also other very good Botox brands from Europe and other countries. So Botox usually comes in an empty bottle. It looks empty, but it's not. It has Botox inside, but you can't see it. And so without reconstitution with saline, you can't use it. So you use a bigger needle. I use about 19 gauge and 3 milliliter syringe to draw up about 2.5 cc for 100 unit bottle, and you put it in slowly and you mix it gently. And after you take this out, you draw up the needed amount for the patient with the 1 cc syringe and replace it with the needle, smaller liter. I use the 30 gauge needle in my practice. Every brand is different and they have the different dilutional instructions, and this is the example of Allergan Botox. For the 100 unit vial, you dilute about 2.5 milliliter of saline, and each unit will per 0.1 milliliter will consist about 4 units. Yes. And for the purpose of this video, although Botox can treat migraines, clenching mouths, and big muscles, I'm going to explain the injection sites for the wrinkle treatments. So there are many possible wrinkle treatment sites for Botox. From my practice, I have used fillers and other cosmetic products for wrinkles, and I found Botox most effective usually on the upper face, consisting of lateral canthal lines called crow's feet, glabellar lines, and forehead lines. I'm going to talk about that. Crow's feet. It's a branching wrinkle at the outer corner of patient's eyes. And there are different types. It's called crow's feet because it resembles bird's footprint. And for better assessment, we usually ask patients to smile. When they smile, you'll see their crow's feet. And glabellar line is also known as frown lines. Vertical lines appearing between the eyebrows, but like as you can see in the second picture, when there is a loss of collagen in the line, we usually recommend filler. So Botox temporarily paralyze the muscle, so it spreads out the wrinkles. But if the wrinkle is severe and they already have the collagen loss, you can't completely get rid of these lines. So it's important to let patients know that they can't be paper perfect, wrinkle free from Botox if their wrinkles are severe. Botox is a great preventative treatment for mild to moderate frown lines because it's before the collagen loss, and the collagen loss accelerates with wrinkles, so it's important to prevent it before it gets severe. And for better assessment, you ask them to frown. Forehead lines. We usually ask patients to raise their eyebrows for an assessment, and the movement of forehead muscles actually causes the wrinkles. So the two frontalis muscles in the forehead are the two major muscles that causes the wrinkles. So some nurses, they forget these anatomy and inject it in the bones instead of muscle. But remember to inject it on the muscle, not on the bones, because it's an IM injection. You're paralyzing the muscle. It won't do anything to your skin or your bone. So just make sure the needle is deep enough, but not too deep to tear apart the vessels or anything, but deep enough to inject the muscles, but not too deep to inject it into the bones. I'm going to talk about a few common side effects of Botox. These are important to understand to avoid them initially, so we have better patient outcome and treatment outcome. Eye drooping, devil's brow, bruising, and safest effective treatment for wrinkles is Botox, so with safe practice. Drooping eye. It looks really gross, but my personal practice, it never happened. It never happens when we understand the anatomy. The cause of drooping eye is when you inject Botox into the wrong muscle. The muscle that is used to lift eyebrows, and you can't really fix it. You just have to wait until the paralysis is over, which is about 3 months, and it will return to normal. But it is best not to see these results and understand the anatomy from the first place. Devil's brow. Many prefer to have eyebrow lift. However, some doesn't when it is overdone because it looks like samurai. It is also called samurai's brows. Severe eyebrow lift causes eyebrow imbalance, so it is not very pretty. It looks very unnatural for some people. The cause of it is also anatomy problem, and when it is injected into the muscle that descends the eyebrow. But this is fixable. A lot of people think it's not fixable, but it is. During the follow-up appointment, we asked them to come in, and we put a small dosage on the eyebrow, which stops the muscle that lifts the eyebrow and descends it slightly. So it is important to let them know that it is fixable, and if not, we can fix it until they enjoy it. They're satisfied. Bruising is not fun, but it's actually a common side effects from Botox treatment. But as long as nurses or the clinicians remember that this is an IM injection and use good lightings to avoid blood vessels during the administration, they can avoid it. And Botox, when you inject it into the right place, it's usually not painful, so avoid the pain sites. And it comes with more experience usually. The cause is tearing of blood vessels, and it usually goes away within 1 to 2 weeks. And a lot of patients, surprisingly, they expect bruising, but when they don't see any bruising, they are more likely to come back for the next treatment. So after Botox treatment, they will see a little bulge on the injection site, but it usually goes down within 5 to 10 minutes, or for some people within 30 minutes. And if they happen to get bruising, we recommend them to cover with makeup. It works fine, but we recommend them to cover it 24 hours after the injection to avoid infection. It is safe when you know your anatomy. So reviewing the side effects, you probably understood how important it is for nurses and clinicians to know their anatomy and how it works. And when you study them continuously, and with experience, you can avoid those side effects 100% of the time. And next, we're going to talk about consultation skills. I've conducted 3 consultations for the purpose of for the purpose of this video with female Botox candidates from 40 to 65 years old, and the permission was acquired to use the scenario in the presentation. And the important consultation skills, I would say, is setting a right expectation before the treatment. So case 1. So there was a 65-year-old female who never received Botox, and she has a severe frown lines with collagen loss, and she said that she is excited to completely get rid of her lines. Yeah. When a person is older, the candidate is older and has a severe frown lines, they're more likely to have a collagen loss on their wrinkle lines. And most people are okay with not getting rid of all of their wrinkles, but it is important to let them know that it only alleviates the severe lines to about mild to moderate line, and they'll still see the line. And if they don't like that, they can use filler that actually fills the loss of collagen. Case 2. A 40-year-old Asian female concerned with a moderate crow's feet. She doesn't want to use more than 10 units to save money. Asian candidates, they don't like devil's brows. They don't like eye lifts at all. So it is important to avoid muscles that that descends the eye lift and paralyze it and make it go up. So she, and also when it's overused, they're more likely to get the samurai's brows, but when it's underused, they're not going to get any result, and it's going to make them more angry. Because remember, the devil's eyes are fixable, but when it's undertreated, they have to get more than they usually needed. So for crow's feet, for both eyes, I usually recommend about 15 to 25 units depending on their muscle mass, but 10 units usually never worked for me. So it's important to let her know that 10 units won't do anything, and if it's underdone, it's not going to do anything. And then there is a way, if she's concerned about devil's eyebrows, there is a way to avoid it and look as natural as possible. In case 3, a 54-year-old female, she's afraid of eyebrow raise because it looks unnatural. We already talked about this. A lot of people are afraid of a natural look of Botox, but when you understand the anatomy and know how to use it, you can avoid eyebrow lift while alleviating some wrinkles. And you need to assess what the patient really wants and how the patient wants to receive Botox. And for conclusion, use sterile techniques and use appropriate personal protective equipments. This is very important, and a lot of people forget it, but it's use your alcohol swabs and use sterile techniques to avoid infection. And educate patient with correct expectations, and very important to know your anatomy. And follow-up appointments are necessary because the result usually comes in 2 to 3 days. Thank you for watching this presentation. Feel free to comment under YouTube reply. I'll be more than